welcome Terry Savage from the Chicago Sun-Times. You won't believe this woman's background. You definitely want to call and talk to Terry. And joining us from Milwaukee, Big Joe Clark, a partner in the Financial Enhancement Group. He is in Indianapolis, and in studio with us, Tim Spees with Eisner LLP. Welcome to everybody. But let's stay on the health care issue right now. Bill is on the phone from Michigan. Bill, welcome. What do you want to know? Hey, Bill, can you hear us? No, Bill.
It's early in Michigan.
I know. Bill, well, hopefully we'll be able to get back to you. But, Tim, we were sitting here talking during the break about what if the government could really do something dramatic and change the way that we as a nation consume health care and put everybody on a level playing field? And you have some insight into that.
Well, I think two things. First, I agree with Congressman Fleming that I mean, getting people engaged and actually having them perhaps fund their own health care is very important, and I think competition is part of that. There's also models which I'd like the congressman to maybe speak about, but the HSA plans whereby
health savings account.
Absolutely, you know, you get tax deductions for funding them. Almost, you know, many of the viewers might have flex spending plans at work where they put their dollars in, they get a tax deduction, they're saving federal, some state, even FICA. And they get to pay for their own health care coverages, and it carries over. They get to pay for eyeglasses and dental care and child care and co-pays, all those things. And I think that's where this goes to, you know, having all of us be more focused on our own health care. I mean, people, actually the studies will show that people pay more attention to their own health care as far as losing weight or exercising. That's pretty well documented.
Well, and it's important to note, too, that if you don't use the money in an HSA, you get to keep it. It's yours.
That's right.
You pull it out. It's almost like an IRA.
Right. But I also think, though, on top of that, the competition aspect is very important because, again, the congressman talks about how services are capped. We go to a doctor, they're capped, you know, as far as Medicaid or Medicare, and there's federal and state programs, they're capped on how much they're going to get reimbursed.
Right.
So that is an issue, absolutely.
Terry, I know how connected you are with individual investors and small business owners, and more I find in just talking to people, one of the greatest financial issues people are facing are their health care costs and how to get insurance, how to insure their employees in a small business. Do you find that?
Oh, sure. Small business owners are just buried. They're the ones closest probably to their employees. They care a lot. But the costs are so great. I've been directing people who don't have health insurance to try these high deductible policies that typically go along with HSAs. So you can go to a website like eHealth Insurance, for example, and choose one that, well, maybe it won't cover the first $5,000, but at least your family won't be bankrupted. It'll cover everything above that in the case of a serious injury. This is a real problem for America, but I just want to add one quick thing. I spent last weekend in Toronto. And if you want to know what the model of a government single-payer program looks like, you don't have very far to go. I was at dinner with a woman whose brother was taken by ambulance to the hospital the day before on a Friday. 36 hours later, he was still in a curtained cubicle in the emergency room because doctors, they don't have very much staff on the weekends. When they finally got him to a room Monday, the doctors came in. They gave him a CAT scan. When they realized that nothing showed up, he had a back injury, they said it must be soft tissue. He said, could I get an MRI? Oh, no, you'd have to wait weeks for that. She is having him driven to Buffalo, not far from Toronto, to get the MRI. So if you want one payer, a level playing field, no incentives for physicians to make some money and maybe work weekends, then you only have to look at Canada and see how long they wait for care.
Terry, you're dead on. I interviewed a woman from Canada just the other day. She had a similar story, awful, came to the States for care. Joe, what are you seeing out by you? I mean, you're in the middle of the heartland. People need to be, they're losing their jobs. They're struggling out there. What are they doing to keep themselves, covered? Because if nothing else, you got to have that high deductible.
You have to.
The emergency care, that is.
Right. We're seeing a lot of people grab a hold of the HSAs and use them, and I think that is one of the biggest things that has to happen is people have to become part of the mix. The attitude can't be that I've met my deductible, so the cost no longer matters, and that's what we see. You know, I live in a town of Anderson, Indiana, that used to be all General Motors. Everybody was there, and you would not believe the amount of emergency room use for basic things because people, hey, they had no skin in the game. So we've got to get the skin in the game. The HSAs are helping with that. I think we're moving in the right direction, but ladies, one of the things that concerns me is we have got the government moving into every aspect of our lives. Oh, yeah. You know, I'm worried about there being a single-payer system if nothing else was wrong. You know, and if we try to move into this thing too quickly, while they're taking over the automotive world, while they're taking over the banking world, well, let's keep praying.
Well, Congressman, it is what it looks like to many people, it is a runaway freight train down in the nation's capital in terms of all the reforms that the administration's trying to put through, starting with health care.
Well, as you know, I came to Washington as a freshman in January, and I was concerned about the excessive spending that had occurred in the 110th Congress, but I never imagined I would see what I have witnessed the last 5 to 6 months. I've been holding on for dear life as we spend billion after billions, trillions of dollars. But
Congressman, Joe makes a great point, and it's something that worries me. You know, I can't focus on making my kids lunch and getting to work on time, and yet we got a Congress that's trying to bail out the financial system, the autos now. We're taking, and we're going to redo the entire healthcare system all simultaneously, all it seems, by the end of the month. I mean, it just seems they have so much on their plate. How could they do any of it correctly?
Well, this is an attempt of government to micromanage its citizens. There's no precedence of this ever working. The only economies in the world that have ever tried this have all failed, from the Soviet Union to Cuba. It's socialism. Even the European socialists are very concerned about the direction we've gone. Even the Chinese, the classic communists and socialists, are worried that we're going far to the left of their
We
economy.
need to take a quick break, Congressman. But can we get a woohoo that $68 billion is being paid back of that TARP money? That's a something. Come on, everybody.
It's like, but it's like you know, we gave out $10 and you're giving me back a quarter.
It's better than that. We got $4.5 billion in interest paid on those preferreds. Anyway, maybe.
Yeah. Well,
again, glass half full.
Glass half full Saturday. All right. If you have to run out, don't worry. You can still catch us on Sirius Channel 145 and XM Channel 168.
We are the Fox Business Network. We care enough about you and your money to get ourselves here early in the AM on a Saturday morning. We love doing it. We're fired up. Call us. We will be right back in True HD.